if the patient tells you that this is good for them, I don't understand how you make a decision and tell them, no, I know better. This is not for you. It's completely ridiculous. You either involve the patient in all the process and you listen to them, or you shouldn't be involved in healthcare.
Welcome to the Joy Tuck Club, the podcast that, unlike the UK Supreme Court, celebrates the beauty and diversity of transgender individuals and identities. I'm Rachel, my pronouns are she, her, and with me is my wife and co-host, the beautiful Phoebe.
Hello, also she, her.
What are we doing today, Phoebes?
We're evolving our ethics, masculizing our chests.
I hope not.
And paying heed to some poetry as we talk surgery, the art of patient consultations, and how to be a better trans ally. We're doing it with another top surgery top surgeon, Ioannis Ntanos, but if you're looking it up online, spelled Ntanos.
Oh, we love talking to Ioannis. It was one of the first interviews on gender-affirming care that we did way back in November.
Yeah.
And if memory serves, we had to re-record it due to a technical issue the first time around.
Mm-hmm. Something to do with the sound engineer. Who's that? Oh, me.
Yeah.
But at least we got to talk with him twice.
Yeah, just a little bit of background for you. Ioannis has become one of the world's leading top surgery specialists for trans men. He's performed over 980 top surgeries so far in the UK and Athens since 2019. And he is a very active member of the gender-affirming care community. And also, he's much more than this.
That's one of the things I really love about him. He was born in Thessaloniki, Greece, about 30 miles from the birthplace of Aristotle. So his love of philosophy and thorny dilemmas could well be a local specialty. But he also has a master's in ethics and law, and these areas all seem to inform his approach to allyship. You can get a feel for that from that soundbite that started this episode.
Right?
Yeah, he does not suffer other foolish surgeons gladly.
No. Allyship is such a constant for Ioannis. We heard it during the presentation he gave for Facial Team,
yeah.
And it continued with some very passionate discussions over dinner afterwards,
fun.
Both in and out of this interview. He's also a dedicated educator, launching masterclasses and contributing to key medical texts. But he considers every aspect of what he does very deeply and seriously, and it gives him a clarity that is quite apparent as he speaks.
Yeah, I'm sure you'll hear that too when you listen to this. So let's get into it. We can't keep more to ourselves. Join us as we dive into his journey, his work, and his vision for the future of transgender healthcare.
Cue the harp.
Welcome to the Joy Tuck Club, Ioannis, and thank you for taking the time to talk with us.
It's always a pleasure to see you, so thank you very much for inviting me again.
Can you please describe what you do in the field of gender-affirming care?
Yes, so I consider myself a gender-affirming surgeon with a focus on chest or on breast. So my background is in breast surgery, but since 2017, I have dedicated my career only to providing gender-affirming surgery, sometimes called top surgery, to trans-masculine and non-binary individuals.
Can I just ask, when did you develop an interest in medicine and surgery?
Well, I mean, in medicine, I must have been like 14 or 15 years old when I first said to my parents that I want to become a doctor. It was during my medical school years, in the fourth year, where I was exposed to what surgery is. And I was fascinated by the fact that you can see the result of your art straight away. So this immediacy of result that comes with surgery was very appealing to me. And I decided right there and then that I want to become a surgeon. Moving, however, to breast surgery is something different because all of us have a background in training in general surgery. And then at some point during your residency, you have to decide which way you're going to go. And breast surgery was something that I really enjoyed. I've spent some time in France doing oncoplastic breast surgery. And I worked in different positions in the NHS in the UK as a breast surgeon before dedicating myself to gender-affirming care.
Well, you've chosen a pathway and a career, a specialization that's seemingly these days constantly embroiled in some sort of controversy. You wrote a really interesting blog post, though, called Why I Do What I Do, which covers your journey towards this specialization. You also describe yourself as an ethicist. So what do you tell people who oppose the type of surgery you do, who call it very, very inflammatory things like cutting off healthy body parts?
Yeah, well, there is no controversy in my head. To me, things are very simple. Most of us should be going into medicine is because we want to help people. And this is what gender-affirming care or gender-affirming surgery does. We help people thrive, be happy, be themselves, go on with their lives. So there is no controversy there for me. Whoever is discussing about controversy is either because they don't understand what gender-affirming care is, or they don't want to understand because they oppose in one way or another a patient's body autonomy. So, I mean, you mentioned something extreme like, cutting off healthy body parts. It's very interesting as a controversy because it doesn't exist, what you're saying. So if we take breast, for example, which is the field that I specialize in, breast as an organ serves two main purposes. One is lactation, and the other one is that it acts as an element of sexual pleasure. So there is nothing essential in someone's being in both of these. Some people will not seek to have children or to breastfeed them. And for some people, it doesn't participate because of their identity and their sexual preference. It doesn't participate at all during their intimate moments. So I'm not sure what people mean when they say we are cutting off a healthy part of their body. In fact, their presence in many cases is the actual problem. We are solving something by doing bilateral mastectomies, which is the surgical term, and we're not creating another problem.
We first met at Facial Team's gender-affirming healthcare forum that we were so lucky to be invited to. And during that forum, you gave a really good presentation on how to prepare for a surgical consult. So we want to sort of dive into that and the three stages, how to prepare, what to do and what to do after. The actual definition of a consult is a meeting with an expert or professional in order to seek advice. What's your understanding of what a consult is?
Yeah, well, there are different schools of thought on what a consultation is. And some of it stems from how we see the relationship between a healthcare provider and a client or a patient. So if we move away, and we should move away from a paternalistic view of a patient-doctor relationship, then a consultation is a discussion, and it's more or less done in equal terms. So both the provider and the patient should have the same goal in mind, and that is to do the best for the patient. In order to do that, that discussion has to be made in equal terms. So my view as a healthcare provider is that I'm there, first of all, to translate the medical terminology in a way that is easily accessible by the patient, and also translate what the patient wants, indifferent of how they will describe that, on medical terms, to see if my skills and their desires can meet somewhere in the midline. That means that from the beginning, I'm not putting myself in a higher position. I'm not the gatekeeper. I'm not someone who knows what's best for you, and you'll have to follow my guidance or else. In fact, I'm there to see how whatever I know can serve for you to achieve what you want. So a consultation is a discussion, and it's a negotiation. We both bring our value to the table, and we see if we can meet somewhere which we both agree with. And this is why consultation does not always have an absolute end. Sometimes, and this has happened to me because, I mean, doctors are patients as well. We use healthcare providers ourselves. And I don't want, when I go to a healthcare provider, to be treated like they know what they want, they know what I want, and they know what I should or shouldn't do. So if we start from that position, a consultation is a negotiation so we can both achieve what we both want, and that is the best for the patient.
That makes a lot of sense. From the patient's perspective, they're no doubt going to get lots of information during the consult. How do you recommend they prepare? What should they bring with them? Should they bring someone with them? What's the best way for them to go about it?
Yeah, so you mentioned the presentation I did for the facial team, and there I divided my presentation in 3 parts. So before the consultation, during the consultation, and after the consultation. And this is because people tend to believe that what's happening in the consultation is the most important thing. But actually, it's before and after what decides the quality of the consultation itself. So before, you need to prepare yourself. And you need to prepare yourself on a lot of things, trying to make the most out of the consultation. A consultation, by definition, has a limited time. And this time should be used wisely, should be used for the patient to discuss whatever is important for them. Yes, the doctor or a healthcare provider will probably have some important things on their mind as well that they want to discuss, but not on the expense of what the patient needs. So prepare yourself by researching what you want to achieve, how do you feel you want to achieve it, how research the medical provider themselves, who they are, what they do, what they are known for in the community or their work, and go there prepared. I mean, if we consider the consultation like an action of similar to any type of consuming, any type. So if I'm thinking that I want to buy something, I will research about it. So you're buying a service, and you'll need to spend at least the equal amount of time that you would spend if you were buying a T-shirt preparing for a consultation. So the better you prepare, the more meaningful the consultation will be.
How long do your consults last? And are there questions that you wish patients would ask you, but they never seem to do?
Okay, so the minimum that my consultation lasts are around 60 minutes. But there is no exhaustive consultation. So once we finish, or air quoted finish, I always tell my patients that we can meet again. If there is something serious to be discussed, if something wasn't clear, if on reflection of what was discussed, more questions come up, I'm happy to meet again with them. And yes, most of the times when I think that someone should ask something, I bring it up myself. And I always change the way I conduct my consultations based on how I reflect on the consultation I have done. So I have performed more than 950 cases by now. And I'm sure that if we would bring in a room my first patient ever, somewhere in 2017, and my last patient, they will probably be having a different view of how the consultation went. So I'm learning new terminology. I'm learning how to ask different things. I'm becoming more content with discussing sensitive subjects. For example, I didn't use some years ago to bring up someone's sexual activities and how this might affect it because of top surgery, either in the immediate postoperative period or in the long-term one. But now I always bring it up because it is important. And because I'm more familiar on how to bring this up in the context of a consultation of top surgery. What I don't want, and I don't know if that answers your question, is to have patients who come to me and say, I trust you, do whatever you want.
Yeah.
Okay, I don't have a preference. I just want top surgery, and that's it. This is not a negotiation. Okay, giving the all clear to the doctor to do whatever they want probably means two things. Either you haven't researched enough, or you feel that whatever you want to ask might put you at odds with the provider. So in both cases, you are keeping something behind. And this is not an equal relationship. This is not a meaningful consultation. So if someone tells me, do whatever you want, I tell them, I'm not going to do everything I want. Okay? Take more time. Bring questions. I love it when patients come to me with a list and they open their notebook and they start questions one after the other. Okay, this means that there is a process on how they approach the consultation. It's much more meaningful for me, and it takes more advantage of the limited time we have.
Do you charge for your consults?
I used to, not anymore.
It's okay. I was just wondering if you charged, and if so, do you have to pay a second time if you wanted a second consult?
Second or third or fourth are never charged. No, only the initial consultation.
So this is really interesting. You've brought a perspective to this. You can tell if a patient's not prepared, and I know from experience that I can feel very nervous going into a consult as a patient. You want patients to be honest and clear and open, right? But now, how does a patient know they're having a consult with a good surgeon? How should the surgeon be with the patient? I
mean, I should ask you, how do you define a good surgeon? Okay. A good surgeon, in my mind, is someone who has the relative skills. Surgery is an art, it's not a science. So you do acquire skills with more experience. But a good surgeon for me is someone, first of all, who is open and honest with what they do. So someone visible, someone who can differentiate between doing a skill is well prepared for, doing an operation, and someone who cares about not only their patients, but about their background, the barriers that they have to overcome to come to you, what happens after surgery. There are a lot of things to discuss. When someone is seeking a gender-affirming surgeon, any surgeon, okay, it's important to find someone, not necessarily myself, of course, okay, someone that they are comfortable with. So being comfortable could be because of their white beard, okay, could be because of the way they use language, could be because of how visible they are on their social media, but they need to feel comfortable. Otherwise, it's just a very mechanical process, something that, okay, let's do a consultation and then let's go to surgery. So it lacks meaning. This is how at least I would like to choose my surgeon. But I know that people who are seeking gender-affirming care, sometimes all they want is just to have the surgery done. And this is an outcome because of people having been rejected so many times when they try to reach out to some healthcare services, that only being able to be offered a procedure is enough for them. Okay? This should not be the case. Okay? Patients deserve more, and they should be looking for more.
So with that in mind, do you advise against impulsivity? I'd imagine that most trans people, both of us are included in this, have more or less made up their mind that they want the surgery before they even have the consult. Do you have a cooling off period? Do you advise people to wait a bit before they jump in with the surgery?
Okay, the term cooling off period stems from cosmetic surgery. And it's there to prevent people from making rash decisions, impulse buying of some kind. Okay, for the most of my patients that I have seen, they have been seeking gender-affirming surgery for years. Pretending that they need a cooling off period doesn't make much sense. Obviously, it's impossible to do a consultation today and tomorrow offer surgery for logistical reasons. So some cooling off period will be there because some preparation is required. Some preparation in terms of paperwork, of preoperative assessment, of making sure you have the right date with the right staff, etc., etc. But cooling off just because, it's an impulse of the moment, let's have top surgery, doesn't exist.
No, I guess it's a life-changing decision, but that's a decision they've already made before they come to a consult. They're just trying to decide who's going to perform the surgery.
Yes, so I have a consultation with someone, and we all doctors, we have some verbal cliches, some specific phrases we use during our consultations. For me, I have one in the beginning and one at the end. So the one in the beginning is that this is not a consultation for me to check if you should have the operation or not. This is your decision. As long as you have the capacity to make informed consent decisions, I'm happy with it. That's the first one. The last one is, if you don't want to have the operation with me, no problem whatsoever. Find someone else. Seek a second opinion. I will refund your consultation fees. No problem whatsoever. So, because some people might think, okay, I spent some money to get a referral, to have a consultation. Now I'm stuck with that surgeon. At the end of my consultation, I tell them, if you're not happy with what happened now, I will refund your consultation. Go find someone else. There is no problem whatsoever. But that's my approach.
That's a nice approach. Are you able to help patients when they're trying to navigate issues with their healthcare providers or the systems or insurers? Perhaps someone's saying, this is elective surgery, not essential.
I think this is again misinformation. I mean, first of all, I think if someone wants to have an operation, this is essential to begin with. If someone wants an operation for the last 5, 8, 10 years, okay, how can you call that elective or non-essential? Yeah. If an operation changes someone's life in a profound way, both practical and emotional, how can you call that cosmetic or elective? So I don't agree with how we differentiate the different type of procedures. It's not an emergency operation. Yes, okay, it doesn't belong to the ER theater, but definitely essential. And if we try to make a correlation between gender-affirming care and cosmetic surgery, a 20-year-old cis woman who wants a breast augmentation because she's suffering of how her body looks, on how she's perceived by others, to me, this is essential. It's not elective, it's not cosmetic. It profoundly affects their life, and if medicine can do something to help them, we should do it.
So let's jump forward now and talk about the actual procedure. You mentioned earlier that you operate with informed consent, and I know you operate between the UK and Greece, but is that the same for both countries, or do I need a referral if I wanted surgery in the UK?
So what happens in the UK in general in healthcare, and this is different from I have practiced medicine in 4 different countries, in Greece, in Romania, in France, and in the UK. And there are significant differences from country to country. In the UK, the gold standard of all healthcare remains the NHS. So whatever the practice is in the NHS, the private sector follows that practice. In the NHS, top surgery is provided in different centers in the country, and I used to work for one of them. And private sector follows that. So since the NHS requests a referral written by a healthcare professional with an expertise in gender incongruence, I have to request the same if I'm performing the operation in the UK. In Greece, the operation is not offered in the public sector, which means that whoever is offering these procedures in the private sector can kind of make up their own pathway. I follow the WPATH guidance. A healthcare referral, a mental health referral is required only in the presence of a mental health history. And that is probably not because I think that someone might be not having the right idea on wanting to have top surgery or not. But if someone is struggling with mental health issues, because it's a major, irreversible, life-changing operation, we should make sure that they are in a better place to go through a major operation. That's it. Okay. So if someone is actively, for example, suffering from a major depression, this should take priority over the top surgery. Other than that, I strongly believe in informed consent. And in the lack of any mental health issues, I'm happy to perform the operation in Greece without a mental health professional referral.
Okay, so let's say I've got everything I need. I'm ready. I arrive at the hospital on the day. What then? What are the steps that happen pre, during, and after theatre?
Yeah, the pathway is the same. Okay, things are happening in a universal way. So you arrive in the hospital, you go through all the paperwork to be admitted, and it's a lot of paperwork. And then the surgeon will come in your room, ask you to sign a consent form, explain how the day will be, do some drawings on your chest, and discuss the potential aesthetic outcome. And then you are either wheeled in the operating room or walk there. Depends on a lot of things, and different hospitals use different policies. An anesthetist will put you to sleep. So top surgery can all be performed under general anesthetic. By the way, for some people, this is the most scary bit, being under, and the operation takes place. You wake up most of the times in recovery, so in a room next to the operating theater. And for most of my colleagues that I know, these cases are now, top surgery is now performed as a day case. So there is no need for spending any nights in the hospital.
I understand that there are quite a few different techniques that can be used. How do you decide which one is best?
Well, what is best is what we can achieve based on someone's chest, on someone's body type, but always in relation with what the patient wants. Sometimes the request is unrealistic. Sometimes I just cannot offer what someone is requesting. I wish I could offer to everyone a minimally invasive approach with minimal scarring and an excellent result when it comes to a flat chest. Okay? It's not always possible. And sometimes, although technically it can be done, there are some specific details that needs to be taken in consideration. For example, if someone is on testosterone, and they have a very hairy chest, their options are limited. A lot of hair in the chest creates situations that you might end up with complications in the long run. Sometimes, although we can do a certain technique, and I have offered recently to some of my patients a minimally invasive technique, but they asked for something else because their partner had that something else, and they want to have the same type of procedure. They want to end up with the same scarring. Okay, so sometimes the fact that we can do something doesn't mean that we should if the patient doesn't want to go that way. So again, we go back and discuss in having consultation as a negotiation. Let's see what you want. Let's see how realistic this is. And let's see if I can offer this to you or not. At the end of the day, however, I have performed techniques where I wasn't sure that this was the right approach for the patient because they insisted a lot that this is what they wanted. Okay? And most of the times, they remain happy in the long run. Although sometimes they might need to come back to me and say, you were probably right. Maybe we should do a revision and correct this or that. Okay. So there are a lot of techniques, a lot of different bodies, a lot of other situations, like I mentioned, the hairy chest, or if someone is smoking, for example. Okay, smoking means that we should take in consideration other things, and hopefully we end up in a joint decision. What I want to say to any potential patient is that they should discuss everything. Most of the times, they will be surprised about what is available. Sometimes they might be surprised by what it's not. But this is why you're having consultation.
Have you ever had any major complications?
Yes, it's a major operation. There are always risks and complications, and I did have major complications. I mean, the most common surgical complication is a hematoma, is a collection of blood after the operation that most of the times justifies a second operation to treat it, a second operation on the same day. But there are complications related to the general anesthetic. I mean, I don't know how graphic you want me to be in this discussion, okay? I can mention allergic reactions, okay? I can mention seizures, epileptic crisis because of the stress of the operation. There are things to be considered. Although, generally speaking, a bilateral mastectomy is considered between surgeons at least, a superficial operation, as opposed to operating in an abdomen or on someone's thorax. Okay,
Right.
so pretty superficial, but not free of potential risks and complications.
So, what results can the patient realistically expect from the surgery? And what are the options for nipple and areola placement and size?
It depends on the technique. So one of the things that I discuss in my consultation is the desire of preserving nipple sensation and how essential that is. I always discuss in a structured way what the outcome will most likely be. And I always add to the discussion an additional question. So I discuss something and then I say, well, is that a deal breaker? Is that essential for you? Can you live with that or without that? So it's about nipple position. It's about nipple sensation, nipple size, scar placement, scar direction, joint or separate scars, how flat you want your chest to be, what's the risk of requiring a revision, what's the risk in the long term of having a malignancy on your chest 20, 30, 40 years down the line. There are a lot of things to be discussed. And this is why it's important to do your research in advance. Otherwise, there is not enough time, no matter how long the consultation will be. I mean, if you ever participate in a lecture and the lecture lasted more than 45 minutes, what happens after the 45 minutes? No one remembers any longer. So the length of time that we can be concentrated and retain information is very limited. And this is why some preparation is essential. Otherwise, there are too many things to be discussed on one or two appointments.
Yeah.
And what do you tell your patients afterwards in those consultations about the recovery time, how long their chest will start to look for them normal? How does that all look?
It's different for each individual. So yes, I always advise my patients to research, but always do that research with a pinch of salt. So someone's experience is their own experience. We all respond to major injury differently. What for someone was a walk in the park, for you might be 2 weeks that need assistance for someone else to recover. What you want to achieve, if you want to achieve an image that you saw online and you say, this is how I want my chest to be, this is completely unrealistic. That single picture of someone else's chest is specific only for them. I have not seen after so many cases, two persons having the same type of chest or the same type of results. And although I'm proud of being extremely consistent with my results, it's never exactly the same image. So it needs some negotiation to convince someone that their ideal result will probably not be achieved, that some compromise needs to be made. But what I tell them is that the more you research, the more holistic, the more universal your opinion and your expectation about the operation will be.
What is a typical recovery time? What can a patient do or not do during that period?
So there are things that are not allowed after a major operation in general, and there are things that are not allowed after top surgery. So let's divide them into. It's a major operation. Someone's body will be using all its resources to heal. So it's not uncommon to feel really tired after a major operation. And even if you spend all day on an armchair watching the telly, by afternoon you feel knackered and you have to lie down. It's normal. Okay. On the other hand, there are certain things that should be avoided on top surgery. So I always advise for no arm over stretching above the level of the shoulders and no heavy weight lifting either. And the time frame that this should be avoided is at least 6 weeks.
Right.
For someone who's having a physically challenging job, it might be even longer.
Right.
Although none of these actions will probably harm the patient. What will happen is that if there is too much tension on the skin on the chest, that the scars might stretch. And the wider a scar is, the more difficult it is to hide. That's, of course, if someone wants to hide their scars. Okay? And if there is no reason to do that or no desire to do that, they can probably do whatever they want.
Actually, that reminds me of something that happened when I first started transitioning. I was at a community meeting of trans people in Connecticut, and there were 3 guys there. And we're standing outside after the meeting was over, just chatting away. And then 3 of them suddenly lifted up their tops to show their top surgery cards. It was very spur of the moment, and they were very, very proud of it. And I fully understand why they may not want their scars hidden.
Scars tell a story. And all scars tell a story in different where they are in the body. I personally, I don't know if that's kind of a professional kink. I like scars. Scars are important. Scars mean that the person has been through something significant. But I understand why on the process of wanting to pass better, someone might want to hide their scars as much as they can.
Yeah.
I have seen scars which I can recognize pretty easily now. I have seen scars of top surgery in someone performing in theater. And I instantly knew what these scars were. Or someone enjoying their sunshine topless on a beach. And that's absolutely fine. But of course, me being involved in this service, it's absolutely fine with me. I don't think that everyone will behave the same way. I know my patients have told me that the first time they were topless, someone asked them to cover themselves. Okay, which doesn't make any sense. Because you wouldn't ask someone to cover any other type of scar, would you?
No.
So if someone asks you to cover your top surgery scars, it's probably because they are transphobes and no other reason whatsoever.
Yeah. Well, that leads us nicely onto a question. And that's, what are your thoughts on the restrictions that are sort of coming to light now around the world on gender-affirming care? And what impact do you think that will have on your practice? And can you help patients who might be denied or cannot obtain referrals due to political interference?
Well, first of all, we need to organize ourselves. And when I say we, I don't mean the community. I mean mainly people with privilege like myself who are offering this type of procedure, we should be advocating for our patients. What's happening with puberty blockers is completely nonsense. I mean,
Yeah.
banning puberty blockers for trans individuals but not for cis individuals is just pure discrimination. That's one thing. Secondly, the numbers are so low of people who are actually on puberty blockers in the UK that it just mean to say that I'm going to prevent everyone from taking from now on puberty blockers. We are talking about, I think in the last article I read, it's around 100 people in a country of 65 million spending all this time and energy and resources just to deny someone care makes me think that it's not about safety. I think it's about attacking patient autonomy. And I say that because it's not completely different from the fact that in the United States, for example, we had a kind of reversal of Roe versus Wade when it comes to access to abortion. It's the same attack on autonomy. It's the same about trans healthcare. At the end of the day, is about attacking rights that we have fought very hard to obtain. And it looks to me like we are moving backwards. And this is why this fight should be involving all of us. So pretending that it will not touch myself as a cis hetero white male consultant privileged person, okay, thinking that this will not affect me is just hiding my head in the sand. Okay. I think that unfortunately gender diverse individuals are the first in a line that will and they are coming for a lot more.
Yeah.
We need to organize. I mean, we need to organize yesterday. There is no excuse of allowing these things to happen.
Thank you, Ioannis. Thank you so much. I wanted to ask you a question about philosophy, but it doesn't fit in anywhere now.
I mean, it depends. I don't know. Philosophy fits anywhere. Okay. I mean, my preoccupation with ethics starts when I was in medical school, and I've started studying bioethics on my own, and eventually I went to the University of Manchester and got a degree on medical ethics and the law. And there are things that are very clear to me, so clear that I honestly don't understand how someone in healthcare can be anti-trans. I don't understand. There must be some serious conflict in their mind. So you either care for people and you offer them as much as you can to make them happy, or you don't. So it's very clear. When someone brings up the second aphorism of Hippocrates, first do no harm. Okay. I always tell them that not doing something can be equally harmful. So there is always a balance. When you're making a choice, you need to balance the benefits and risks. Okay. If the patient tells you that this is good for them, I don't understand how you make a decision and tell them, no, I know better. This is not for you. It's completely ridiculous. You either involve the patient in all the process and you listen to them, or you shouldn't be involved in healthcare.
Ioannis, thank you so much. Your About section on your website says, outside of your passion to providing excellent care to transgender individuals, you also enjoy reading poetry, playing the piano and travelling. Do you have a poem for us?
I read a lot of poetry, and I have favorite poets and favorite poems, and I can read a poem for you from one of my favorite poets. C.P. Cavafy.
Fantastic. Yes, please.
So the name of the poem is Walls, and the translation. I mean, it's written in Greek, but the translation that I prefer is by Edmund Keeley and Philip Sherrard. So, with no consideration, no pity, no shame, they have built walls around me, thick and high. And now I sit here feeling hopeless. I can't think of anything else. This fate gnaws my mind because I had so much to do outside. When they were building the walls, how could I not have noticed? But I never heard the builders, not a sound. Imperceptibly, they have closed me off from the outside world. To me, it's a very important poem because I hate walls. And if we are to build something, I prefer we build bridges and bring down the walls.
I think that's the episode title, Breaking Walls and Building Bridges with Ioannis.
It also speaks so strongly about the experience of being transgender and feeling the restrictions come into play.
I think you're right. And I'm a cis hetero male, yes?
Yes.
Yeah.
This doesn't mean that I don't know what barriers are. This doesn't mean that I cannot understand how world should be instead of what it is now. So this is why I keep saying that we fight the same fight. A fight for gender affirmation care is a fight for all of us, okay? And if I can quote something from a very known book by Sean Fay, okay? Trans liberation will set us all free.
Yeah.
Well, Ioannis, thank you for being such a wonderful guest and for sharing so much experience and knowledge and hope and joy. Speaking on behalf of all trans people, thank you for not shutting us out.
Thank you.
It's a pleasure and a privilege.
And welcome back. That poem, Walls, is so apt for right now, given last week's decision here in the UK by our Supreme Court that's already being used to devastate trans rights. C.P. Cavafy, the author, was gay in a country where that simply wasn't allowed. But today, conservative forces are trying to draw that same wall around society again to keep us out.
As they say, transphobia is just recycled homophobia.
Yeah. And the surgeons who perform gender-affirming care also get the sharp end of this stick. Remember when one of the founders of Facial Team said his work was called ignoble by other surgeons?
Yeah, and I must say I really liked Ioannis' response to claims that people are cutting off healthy body parts. His explanation as to why it's fiction.
Yeah, it's simply, that's not true. They don't perform any useful function for the person having those parts.
No.
Yeah. That's why the medical guests on this podcast, they're always so firmly on our side, because this isn't just about us being their patients and not, as some like to say, they're just milking the community. And it's also more than empathy. They're not just feeling sorry for us.
Oh, they really care.
Yeah, and they get so much personal reward from this, so much job satisfaction.
Yeah.
The thing is, they've met with hundreds and sometimes thousands of trans patients. They know our motivations as well as we might ourselves. They know them better than anyone. And so it makes them willing to take their own career risks, to be told they're performing ignoble surgery, to receive online hate, physical threats, all for helping us. They know they're doing a service, not a disservice.
Yeah. Oh, that reminds me. Ioannis pointing out that the puberty blocker ban isn't to do with patient safety.
Yeah.
It's about attacking patient autonomy. The same in the US with the overturning of Roe v. Wade and increasingly restrictive abortion rights. It's about the removal of freedoms that were hard fought to obtain.
Yeah.
The fight should involve all of us, and it increasingly does.
Right. So, those demonstrations the past week in the UK after that just disgusting decision by the Supreme Court here. And even though they said, it only applies to the Equality Act in this particular sort of scenario, well, not scenario, but within its purview, I suppose. And yet the TERFs have already taken it and applied it everywhere. But that demo had more cis people than trans people. There were 20,000 in London alone. And they're there because not only they support transgender rights, but because only the most willfully, blindly bigoted cannot see these erosions in general rights taking place.
Yeah, they see our presence as a blight, evidence that the world doesn't perfectly match their belief system. It's why, as Ioannis also mentioned, someone can be asked to cover up top surgery scars. Why? To cover up their transition.
Yeah, we must be hidden. The evidence of our existence must be hidden. Yet the other thing they do is the gatekeeping, the delays in surgery, the insistence that you need to think it over. Can't possibly do this until you're a legal adult, and even later now they want. But anyone, as we heard from Ioannis, anyone wanting a bilateral mastectomy, as top surgery is known, has already thought long and hard about it. They haven't arrived at this decision with no consideration. So why have a cooling off period? They don't need to go home and think about it. They've been sitting at home thinking about it non-stop.
Yeah, it's also a reminder of why this care is so necessary. This is also one of the reasons, he says, that those performing gender-affirming care need to organise themselves to help the community further and to advocate.
And you don't need to be a philosopher to understand that. It's right out there. By the way, if any of you want to hear more from Ioannis on all sorts of trans topics and maybe a little philosophy, search for his The Top Surgery podcast. It's really, really good. Mm-hmm. We'll include the links for you as well in this episode's notes.
Yeah, and his latest episode actually has another guest on our podcast.
Oh, yeah, that's right.
He interviewed Danny St. James.
He did.
It's a great podcast, well worth a listen.
Yeah. So that's it for this episode of the Joy Tuck Club. We'll be talking with Dr. Ollie Kerwin in our next episode. He's an expert in aesthetics and injectables.
Oh,
I know. We'll be taking the plunger in that one.
Really giving you the point.
Meanwhile, we want to thank you, our listeners, for tuning in and being part of our community. If you want to connect with us further, please visit our website, redandfreckles.com, where you can keep up to date on all things red and freckly.
You can also follow us on Blue Sky, Threads, Instagram and Facebook, but not Twitter. We use the handle @2damptrans on all platforms, and you can DM us if you have any questions or topics you'd like us to discuss.
And please don't forget to subscribe and rate us on Spotify, Apple, YouTube, wherever you listen to podcasts. We're on all the popular platforms now.
And even some of the unpopular ones too.
We appreciate your feedback and support.
So until next time, remember you are valid.
You are beautiful.
And you are transcending boundaries.